So, welcome everyone, and thank you for joining AMETHIST Penn's September 2024 seminar. We are proud to offer this content through our Amethyst at Penn Hub, which stands for Achieving Maternal Equity and Transforming Health Through Implementation Science and Training. Funding for this hub comes from the NIH's Improve initiative, which aims to reduce maternal mortality, improve pregnancy, perinatal, and postpartum care, and to address the factors that have led to severe disparities in outcomes for marginalized groups. As a reminder, we are recording this discussion and it will be available on our YouTube channel for review after the session. Please feel free to put any questions into the chat throughout the session. I'll be monitoring that, and then we will get to those at the end, where we will likely have time for additional questions. This month, we are very fortunate to have Ms. Debora Grandison here with us to speak about connecting, collaborating, and contributing for change, the powerful impact of storytelling in healthcare. Ms. Debora is a wonderful part of our team. She is one of our patient co-investigator, or she is our patient co-investigator. She's also an author and a poet, an inspirational speaker, and a health advocate. So we're very fortunate to have her today. And now I will turn it over to you.
Hey, well, thank you so much. I appreciate you, Casey. And I just want to welcome everyone today. Thank you for joining in on this conversation, connecting, collaborating, and contributing for change. So I first wanted to say it's my absolute pleasure to be here with you today to share some of my lived experiences and my perspectives on highlighting the journey that I've been through, the struggles, the triumphs, the failures and successes that led me to today, and that also just continue to motivate me to have the desire to be an advocate and share my survival story. So I want to use my voice as a change maker. And so I often begin my presentations by stating that I can't share a 35-year journey in 20 minutes. But my hope is that this conversation today will be the opening and lead to more opportunities to share more detailed information about my experiences as a survivor and health advocate. So we're going to start with a video that I prepared as an introduction to who I am and why I'm so passionate about this work that we're doing together.
Hi, I'm Debora Grandison, a 35-year heart disease and diabetes survivor, living with a pacemaker, an insulin pump, and a purpose. My health journey began during pregnancy, and that road took me across many paths. Time spent in intensive care, a lengthy hospital stay, and a very challenging pregnancy. Following the birth of my son, I continued to be treated for a heart diagnosis that I later discovered was inaccurate. I spent the next 20 years searching for answers. I also would experience severe symptoms that led to additional misdiagnoses, misunderstandings, and mistrust. I had to fight hard to advocate for myself, and while doing so, I grew a passion for advocating for others. I encouraged others with powerful stories to consider sharing their stories. When making the ask, I would get the same 3 reasons why they shied away from sharing. Number 1, they weren't comfortable speaking to large groups. Number 2, they felt that no one really wanted to hear their stories. And number 3, they did not want to revisit their experiences due to the trauma and emotional distress that it caused them. I've discovered during my 13 years of advocacy, speaking, and educating that storytelling has such a powerful impact in healthcare. It can open up dialogue that removes communication barriers that can potentially hinder patients from receiving the best quality of care possible. Patient stories not only humanize medical practice, they are a compelling way to communicate information and provide medical evidence. I believe that some of the ways that we can overcome some of those hurdles that limit patients from sharing their stories are listen to patients. They want to know that they are being heard, respected, and validated, especially after experiencing the emotional ups and downs of a health crisis. Encourage patients to participate or engage in any community forums that may pertain to their health diagnosis. This may lead to their desire to lend their voice to the mission of advocacy and provide patients with materials that speak to the significance in sharing their stories, highlighting the fact that their stories have the power to not only change lives, but save lives. Knowledge is power. This is our opportunity to remove the barriers of communication, increase health literacy, and reduce disparities through the power of sharing compelling stories.
So I wanted to share that with you, and my decision to share my journey, it started in 2011. That was after me receiving a pacemaker and working through some of the, navigating through some of the trials that I experienced. When I reached out to the American Heart Association to join about any speaking opportunities that they might have, I immediately signed up and began my journey to use my voice to make a difference. As mentioned in the video, some of the benefits gained by patients sharing their personal experiences about their health are patient stories help to humanize medical practices. Hearing patients' individual stories remind us that each person is unique, and the way they deal and respond to their symptoms, diagnosis, and treatments may be completely different than anyone else's. Patient stories help to provide medical evidence found through laboratory testing and documented research, such as MRIs, CT scans, and blood work, just to name a few. Patient stories help medical practitioners and staff reduce communication barriers with their patients. Challenges in communication can limit the quality of care that a patient receives. And we'll go into more depth with that about the communication barriers at our next seminar during part 2. How can you identify and where can you connect with patients that may be willing to share their stories? You can put out an invitation at your local clinic, hospital, or medical center. Maybe your hospital has a speakers bureau, or an invitation could be extended to patients to share their stories during Heart Month or National Diabetes Month, to name as an example. In 2015, I received a call from my heart and vascular office, and they invited me to come in and learn about a new technology for pacemakers. That team was learning about that at that time, and they asked me to join them. I jumped at that opportunity. And so it opened up an opportunity for me to be the face for the product. They did an infomercial with me, and it led to a trip to the company's headquarters to speak to their executives and their researchers. Reach out to patient advocacy groups and support groups and forums. I facilitated support groups at a local hospital as a Women Heart Champion. I've served at a local hospital on their Women's Health Advisory Council. And I participated in a number of forums on both heart and diabetes. Connect with new moms and moms playdate groups. Many new moms are willing to share their personal experiences regarding their heart issues before, during, or after childbirth. Being diagnosed with gestational diabetes, preeclampsia, and or postpartum depression. They may also be still in the throes of seeking answers and support in their circle of peers. Organize a mom's meetup so that the new parents and seasoned parents can connect and share their personal experiences. One year, I even went to create an opportunity to connect with my neighbors. I live in an 80-home subdivision, so I went out with invitations to each neighbor, inviting them to a Go Red for Women event. A heart-healthy lunch was served, goodie bags were made, and filled with heart information and recipe books, and I shared my personal story with all of them. Some were aware of what I'd been through, and some were not. I finished with a survey that I created, asking them what they received by attending this event, and several of them shared that the event was very informative and that they would be scheduling overdue checkups. So we know that there's power in sharing our stories. Local health fairs is another opportunity. Wellness events, outreach to faith-based groups, organizations, or health ministries have been established in local churches. For several years, I've set up events at churches during Heart Month and Diabetes Awareness Month in order to promote awareness and meet survivors that are willing to share their personal stories throughout the community. As mentioned in the video, patients often shy away from sharing their stories. Here are three that I would typically hear when I'd make the ask. I wouldn't be comfortable speaking to large groups. No one wants to hear my story. There are so many more compelling stories to be told. And I don't really want to talk about or remember what I went through. It was too difficult and traumatizing. Each of these above reasons are real and valid, but I have witnessed people changing their minds about sharing after hearing the other compelling stories that patients shared and realizing that what they've been through has the power to make an impact. It's often helpful to find purpose in their journey. It certainly did that for me. What type of impact can sharing patient stories make? And where is the greatest impact made? When patients decide to share. When patients are willing to share their stories, it opens up an amazing dialogue with other patients dealing with similar issues. It brings awareness to those who may not be presently impacted by medical diagnosis, but may have family members who are. Some people are often open to learning all that they can about the journey of a survivor because they desire to take the preventative steps to remain as healthy as possible. Patients are more likely to remember information shared when it's delivered through a story. Storytelling inspires, informs, encourages, and it gives hope. Some patients telling their stories help them to reflect on where they started and how far they've come. When patients speak out about their health journey, it may also open up opportunities for needed dialogue with family. Hearing what they've been through can give them a greater understanding about the challenges that can potentially impact everyone in the family. I recently appeared on a local talk show, and I received feedback from family and friends stating that they had no idea of some of the things I had gone through. One friend said watching the interview inspired her to check further into her own health needs. When patients share their health stories, it can help promote personal healing and growth. When a patient can reflect on what they've been through and are reminded how far they came, what they learned, it can inspire and motivate them to take a role in advocacy. Many will find their own path to healing. I'd like to speak to that for a moment. I found my healing when I was out sharing my story with others, and it actually led to me writing a book of encouraging poetry and prayer. So healing can come from sharing your story. When patients share their health stories, it can help promote personal growth, as I said before, and healing. And it really can then improve the patient and provider communication when patients share their stories. It allows patients the opportunity to be heard, to express their fears and concerns in order to inspire change and improve the quality of healthcare for the future. Patient stories promote community engagement, increase awareness, prevention, advocacy, and education. Patient stories provide researchers with a greater understanding of the patient's experiences while navigating through diagnoses, testing, and medical treatments and procedures. Patient stories also have a significant impact in the act of policymaking. Patient stories can help make the policies relatable and understandable because there is now a face attached to the issues being discussed. When a patient shares their experiences and the impact that a change in policy can bring, people are more drawn to the stories than to statistics. Patient stories provide a relatable viewpoint that can be a powerful addition to the context of current policy discussions. Storytelling for policy change helps policymakers connect with empathy, and it helps people connect. Storytellers make the issues relatable to the people that are in positions to make changes. Storytelling paves the way for more effective means of communication between advocacy and policy. As a member of the American Heart Association You're the Cure advocacy team, I was able to travel to my state capital to lobby for a number of bills over the years. And I spent time on Capitol Hill to lobby for more funding for Women's Heart in 2016. There is no limit to the impact that patient stories can provide to bring change. Maybe you have already identified with a few patients or have a few patients in mind to reach out to. Or maybe someone's already expressed an interest in sharing their personal stories, but you're searching for ways to put their stories to work in order to make the greatest impact. I would love to assist you in crafting questions or creating dialogue to develop your team of storytellers. Please let me know how we can connect and collaborate and how I can contribute to this impactful initiative for change. Part 2 of this seminar will focus on the barriers that lead to miscommunication between patients, clinicians, and physicians. And I will share some of the challenges I experienced while searching for answers and some of the conversations that I've had with other patients that are working through to navigate through their healthcare system. And we'll talk more about the disparities of maternal health. I look forward to seeing you on October 4th. And I just want to say thank you for all that you do. There's a link here that you can go to for additional information, determining patient readiness to share their healthcare stories, a tool for prospective patient storytellers to determine their readiness to discuss their healthcare experiences. Thank you so much for this opportunity.
Thank you so much, Debora, for such a wonderful presentation. We're so thankful to have you on our team and to be able to speak to such an important issue in this space as well. We'd love to open up the floor for questions or anything of that nature. Any stories people want to share or just questions for Debora in general.
Ms. Debora, I have to thank you so much for your comments, and it's lovely to hear your story in another way because we've had the privilege of getting to know you. You talked a little bit about the barriers that keep people from sort of taking on this mantle, and I think that resonates with me, and hopefully it resonates with other people too. If you were going to give advice to investigators as to where to look for potential partners, if they're clinicians, are they looking to their patients? If they are researchers, are they going to their institution and looking for committees of folks in the community? Like what sort of tips would you give to researchers as they say, yes, I'm totally on board. I want the people. Where do I find them?
Wow, I think you touched on all of those. And so what's happened for me is I've had an opportunity to kind of be in each one of those seats, so to speak. So, I've worked with AHA on their research teams. And so there was outreach to me because they already saw me out speaking. So I was invited to step up to be a part of their national research project. I think within the healthcare system, hospitals, I believe, oftentimes will have maybe some circle of people talking about particular things I mentioned in my message about during certain months of health, heart month and diabetes month. Are they doing anything to speak to their the workers, the care team? Are they speaking to them? Maybe they can have go to someone that they maybe had a conversation with, or put out an invitation for someone to come and step up to want to share their story. Again, it goes back to us really emphasizing the great impact that can be made in sharing. And so if there's some kind of way for them to put something out about impact that might trigger something with someone who has been through some things, and that might be the people that they go to and say, we're getting ready to do something for our team. We want to give you more. We want to hear what you've been through. That's again, that validation, right? So there may be patients who are like, man, this is an opportunity. I need to step up to this because they're telling me that they are interested in what I've been through. So this is my opportunity to be a part of that, change. So I don't know if that kind of makes sense, but just any kind of opportunity where there's an invitation to speak or to share within the healthcare system. Again, I know that faith-based opportunities come up all the time. People who are living and knowing that healing comes, and they're praying and doing all of that needs to happen there. They are interested. There are people who are interested in being a part of something like this. I do believe that. And so it's that I want to share my testimony. You might hear we're saying story, they might call it testimony. And they're sharing, they want to have that opportunity to share their testimony so that they can see change, within their communities, their church family, congregation. I often say this. I used to go and knock on doors at churches and tell them why I was there, that I was, working as an advocate, and I wanted to have a moment to be able to stand at their podium during their morning announcements and share something. And I'd oftentimes get, well, we don't do that, honey. If you have a flyer, you can send it. And so what kind of touched my heart was, if the churches are meant to do outreach within the community. If you're not starting with educating your congregation on these kinds of things, how are they doing the outreach that's necessary? So faith-based is another place where someone might connect and find people who are willing to share their stories. I don't know if that's.
No, that's wonderful. Thank you. It looks like there's a question. Well, there's some questions coming through in the chat. So from Shelby, Shelby says, I'm definitely curious about how other centers are inviting patients into aspects of their projects or how they're hoping to do so later in their project. So if any of the center-based investigators are brave enough to let us know sort of how this is played out in your own centers, that would be lovely. Either audio or in the chat. And while they think about it, you have another question from Angela. Some people, particularly providers, may perceive storytelling as negative if the experience was negative. So how do you overcome that barrier? And Angela, the way I'm interpreting your question is that if the patient or the advocate had a negative experience in healthcare, then a provider or a researcher might be hesitant to bring that person in. Is that what you meant?
Yeah, that's the gist of it. Or they may not be as amenable to having storytelling as part of their, their program, because they think it'll just be bashing and negative press and those type of things as opposed to beneficial.
Ms. Debora, you've had some stories that weren't always positive. So how would you talk about that?
Yes, that is so true. And thank you, Angela, for your question. So we're gonna, as I said, gonna delve more into some of the challenges that I experienced during part 2. But honestly, for me, and I guess it really does depend on the perspective that a person has. I'm always looking at those being able to shift or make a turnaround in something that comes out or looks negative, and seeing, like I said, some people are going to see, this is where I was, this is where I began, but this is what I've gone through. This is what I've been through. This is how I, have, it was a struggle, but I was able to get past some of those things. Hopefully, prayerfully, because we're trying to do it within the healthcare arena, they have doctors and staff that have assisted in that. So that's a positive. If a person's had a negative experience, we want to pull the positives out of that, because, there's always going to be someone who's going to have a negative experience, unfortunately. But there are, I'm believing, a gazillion clinicians, medical staff, teams, all that really want to see change. So if I don't know if I'm touching on what you're looking for, Angela, but it has to start. Let's see, how can I put this? We can't see the greater unless we can see some of the less than, if that makes sense. So some of the negative stories need to be shared in order for us to get to where we really want to see the change and the growth. And education is huge. I mean, I'm without going into too many things, but listen, when it started, I was 28 years old and I didn't know anyone in my age group who was dealing with the things I was dealing with. And I was doing research. I don't even know if I had a computer then, but I was doing whatever I could to get information, just trying to figure things out. And I was lost and I was, discouraged, and my energy was depleted and all those things, not only just the physical, but obviously there were a lot of mental things that went through. But this is why I do what I do, because I am here to share that there is hope. That's what I hope people see when they hear this testimony and they see the smile on my face because I'm grateful. And believe it or not, I'm grateful for the journey because it would not have put me in position to do this. And this is powerful. This is change making. This is, I can't begin to say how thankful and grateful I am for this opportunity. And I believe there are other people out there who want to do the very same thing.
So, Ms. Debora, what I'm hearing you say is that that's a negative story is not necessarily a reason to hold back,
Right.
and that there can be some good that comes out of that.
Yes, ma'am. Yes.
All right. We have a question about when you're collecting stories from the IRB, the Institutional Review Board, or when you're collecting stories from patients, do you need IRB approval or just a consent for people to share their stories with you, letting you use it for non-commercial purposes? So sort of in the systems that we work in, how should researchers and other people that want to communicate stories, how should they think about those stories? How should they handle them sort of logistically? That seems like a tricky question.
That's not for me, right?
Well, we can work through it together. I will tell you, the first question I would ask is whether it's for research. And sometimes there are stories that are collected for the purposes of what you could call advertising. And it's not really advertising, but it's meant to elevate the stories and potentially start a conversation. And I'll give you an example of something that we're doing at Penn Medicine. I'm not doing it, but there's something called the Listening Lab, which is led by Aaron Levy, who's actually an English professor at Penn. And what he does is get people to tell their stories. His team gets people to tell their stories, and then they edit them and then they make them publicly available. And the stories are patients who have lived through various conditions or ordeals, but also healthcare providers and how they've experienced care. But that's not research, right? So they have people sign a consent form to record them and to edit their stories, and then they give the people who shared their stories ultimate authority over whether that thing gets published. So that's certainly something that you want to think about, is making sure that whoever's telling their story is comfortable with the way that their story is being told, especially if there's an intermediary. From a research perspective, I would say talk to your IRB because they're all very different. And so if you can distill down what the purpose of the storytelling is, so for those of you in the Improve initiative, maybe you're using storytelling as an implementation strategy, then that probably falls in the category of research, and you will want the IRB to know about it and you'll want to follow all the procedures there. But I would encourage you to have a conversation with them first to understand how they're thinking about it and what they want you to do. Ms. Debora, how have you, I'm sure you've been asked to sign consent forms and things, like what are the various hoops that you've had to jump through when you've worked with folks?
So yes, I've done a number of things for for magazines, for television, radio, and so there's always a consent form. I'm very transparent, so some of the things that other people might kind of push back on, not knowing. And we think about HIPAA, obviously. There are a lot of people who look at HIPAA and they say, well, should I even be, trying to share, information about my medical I haven't had a lot of issues with it because I just believe I'm doing what I've been called to do. I don't know if that's,
No,
helpful,
that's
but
great.
yeah.
I actually have a question for Carl, who's one of our partners who's on the call, and I don't know if Carl is in a space to be able to talk. But this reminds me of the conversations that journalists have with sources, and how can you be a responsible steward of the stories that are being told to you as a journalist? And as a researcher, I've been told, make sure if you're talking to a journalist, figure out whether it's on background or if it's going to be on the record. Make sure that you're able to look at it or listen to it before it actually goes out. But Carl, if you're available to say anything about how you've approached that, it'd be awesome.
Yeah, no, it's really important issue. And I think that I think when you talk to the media, you really want to plan it out first, and you really want to focus on maybe 3 or 4 things that you really want to get across. Because you don't want to talk about a whole range of subjects and then have them pick which ones they want to cover. You really want to get a very, very tight focus and even practice and have some language in there. And yeah, it is really sensitive for patient stories. And I know journalists give a lot more leeway to patients to be really clear about what they're going to say, at least the journalists I worked with, and make sure that they're comfortable with it and have thought through some of the ramifications, like how it could affect their family, their jobs. Generally, though, it's been a pretty positive experience because it's so universal and it's just, it's really, it can really change the world. It can change mountains, like the kind of what Debora said about, it takes stories really to change the legislature more than data. I mean, you need both, but it's like the combination is pretty powerful. Anyway, I'll stop there.
That's wonderful. Thank you so much for that perspective. We have another question that says, what are some things to consider when encouraging storytelling with teenagers who are maybe less experienced in using or trusting their voices?
So I don't know. I'll try to. I'm thinking about some opportunities that I've had within the school districts here in my town of St. Louis. And so every year I go and speak to teens. And what I try to do is I try to craft my message to, their lifestyle. So example, I go in and I do something on diabetes. I forgot how many groups of teens were in this room, but I started thinking about the incidence of if you have a wound, you cut yourself and what can happen to a person who's diabetic. So I started out by saying, how many of you love to go to the beach? And of course, everybody in the room is like, And so then I'm telling it's like you like to walk and, sand between your toes. It feels so great, da da da. And then I say, I can't walk on the beach like that because if I cut myself, I could end up with a wound and it could eventually end up being an amputation. And of course, it gets their what? That gets their attention. But I know this is a little bit different maybe than what you're saying, but at the same time, I believe in meeting people where they are. So I try to think about the audience that I'm going to speak to. And I do have an opportunity, as I said, to go and do something for, it was called the Incidence of Obesity and Diabetes in that program. And then every year I go and do oh goodness, Deb, it's kind of CPR and some other things at one of the other local high schools. And so just thinking about that group and crafting it so that it includes something that would really capture their attention. And it can be done. And one of the biggest things for me is with prevention of heart disease. I want young people to know, because if we can get them on the right track early, we're going to save a lot more lives. And so I really believe that it's doable to really craft the conversation so that it gets their attention and they want to actually kind of talk.
That makes sense. I think there's a few different ways that teenagers interface with this concept, and it might be as the audience and it might be as the people who were telling the stories as well. certainly building connections makes sense, but building connections might look very differently depending on the generation that you're talking to. There's a
Mhm.
really good book by someone named Hayden Shaw called Sticking Points, and it's about all the generations that we have in the workplace. And granted, we're not necessarily talking about the workplace here, but there are some common features between the generations in terms of how they tend to engage with information. And at least as a starting point, it's an interesting way to think about how to engage people who are in those different generations. In the Amethyst family, we have someone named Robin Stevens, who's a professor at USC, and she does a lot of work on social media, working with teenagers and youth who are telling their stories. So we'll reach out to Robin and see if she has any suggested readings for the group, and then we can post those for the attendees so we can get some more information for you. Ms. Debora, you have a question about whether you've ever been a part of telling your medical story to policymakers. And if you have been, can you talk about how that went and whether it led to any change?
Yes. As a matter of fact, I believe it was during when we were trying to get the bill passed on smoking um, in schools. And I was in Jefferson City, and I met with, I live in Missouri, for anyone who doesn't know that, and state capital is Jeff City. And I went to talk to the representatives there. And so, of course, it was an opportunity to share my personal journey and my feelings on, the need to make the changes. The bill was passed. I'd like to say I was part of that, happening. But sharing the story again, as I said, it allows people to see a face. I think it's so important. We can look at statistics all day. We can read, these bills and, just pass them on to the next person. But when you have a face with it, you have someone who has a compelling story, someone who's looking you in the eye, engaging with you and saying, we need to make these changes. I want my life to be different, and I want my future, my children and the future to be different. I think it helps. And so the storytelling with policy I think it's crucial.
That's great. Now, one of the things that comes up in research patient partnerships is the concept of compensation and giving credit and the general sort of concept of rewards for what you're doing. And certainly telling your story is its own reward in some way. But can you talk a little bit about how you think about your contribution being acknowledged and ways that you think either providers or researchers can demonstrate their appreciation, that it's appropriate to demonstrate their appreciation of people telling their stories?
Wow. Well, so I will begin to say that, as I said, I started this journey in 2011, and none of the things that I did as a volunteer were ever compensated. There were days when I would go from one event to the next. I'd hand out brochures at this thing, I'd speak at that thing. And so the benefit for me was the reward for me was, as I said, I developed a passion for advocacy in my own need. There were times when I was afraid. There were times when I was frustrated, fearful, and I knew other people were in that same space. And so it's such a strong feeling that I had. I had to do this. I mean, it's a part of me. And so I would say that maybe it makes sense. Let's see. Okay, I'll just say this. I'm working on something through my own LLC, which is She Speaks from a Joyful Heart. And I want to acknowledge some of the other survivors that I've been, gotten to know, heard their story, know what they've been through. And I'm looking at trying to figure out, what can I do? Can I have a day, like a survival event? Because to me, bringing them in to help let them tell their story, have a room of people who, they're making an impact, but maybe have some kind of an award made up for them, joyful heart. I've been kind of working through that. But my point being that people always want to be acknowledged for, their work and their efforts. What that looks like, I don't know. on the financial realm. I know it's, that's probably not possible or feasible with some organizations, but some kind of way of just having an opportunity to really express what a great impact their stories have made. And just some token. I don't know if I'm.
No, that makes sense. I mean, I think it is important to acknowledge people and what they're bringing to the table. And even if it's not a tangible financial contribution, I think it's really important to show your appreciation to people, especially as they open themselves up and tell their stories.
Mhm.
That brings us to the end of the stories or the questions in the chat. Is there anything else you want to share in this part one?
Oh, well, I
Oh, wait,
always
we got another
wanted to.
question.
Oh.
Sorry. For storytelling, what is a good channel for delivery? YouTube, conferences, website? Are you writing pieces? Are you doing video, audio clip? If it's an audio clip, how long is it? Now, I know you've done a lot of these. So I'll repackage this question and say, how do you decide what the format is for any given application? How do you decide whether you want to write something or you want a video or you want to go in person?
So this is the thing. As I said, meeting people where they are. So it's kind of knowing what the audience is in need of, if that makes sense. I write and I put things on. I don't do a lot on YouTube right now. But I do a lot. I just opened up TikTok and I'm doing some poetry kind of things there. And of course, I share some of the pieces about writing is always a huge, um, place for me to do things. I think that it's important to kind of navigate through all the different entities because you're going to meet people and you're going to, just like anything else, meeting people where they are, you're going to have people who are in one arena and somebody else who likes to read and somebody who doesn't like to read but likes to listen. Maybe it's audio, like a podcast. So I think you got to kind of tap into all of those things so that the outreach of course is far greater when you're in all those different areas, if that helps or makes sense.
Absolutely. And when you think about an audio or a video medium in particular, if it's just you, what's a target length? Like you showed us your video at the beginning, but is there a certain sort of, oh, I want to get this out in snippets that are this long? Do you think about it that way?
Yes. And so when I auditioned for the Go Red for Women, I was national spokesperson back in 2019. They gave you a timeline of you got to tell your story, or you need to audition with a, what was it, 1 minute, 60-second piece. And I thought, 35 years, how am I going to do that? But I talked fast. No, but I tried to figure out what the key points were that would help draw draw them to maybe desire to have me as one of the team. And it worked. I will say that my dear friend Carl, we've had these conversations in our meetings. And so he, of course, as a journalist, has emphasized that it is significant to keep it at a certain level because you will lose people very quickly. So, and I think the other thing is when it's smaller, when it's shorter, what you're doing is you're opening up an opportunity for people to want more. So it's like, okay, here's your appetizer. Now, if you want to learn more, have me come back and we can talk about that kind of thing, if that makes sense.
It
So
does. Carl, I've learned from you too that short is sweet. Can you say a little bit about how you think about the length of, media that are moving or dynamic audio and videos, what I'm thinking of versus something that's written?
Yeah, we live in a world where the attention span is incredibly short and it really needs to be direct and to the point, and brevity is prized above all. And in video, anything more than a minute is an eternity. And it really requires really good visuals, like not just a talking head, but something to compel the viewer to stay in there. So yes, short and multiple is better than one long.
That's wonderful. Well, I think that's a good place to wrap up because we're at the end of the questions and it's been, you know what? Y'all keep asking questions. It's okay. We have time. I appreciate it, but you got to give me a little bit of lead before I try to close it out. Okay. Do you think that storytelling comes with stigma? And if so, how can it be managed? And the way I'm interpreting that is that, sometimes people are telling stories about things that are difficult to hear about, things that they've experienced that maybe they don't that can be difficult to talk about, that could be associated with stigmatizing conditions. So how do you manage that stigma? And then another
Mhm.
question is, when a mother is mistreated during childbirth in a hospital, for instance, is it necessary to mention the hospital name when you're telling stories, or will that be regarded as defamation? Oh goodness, let's do those two separately. So let's talk about the stigma piece first.
That's it's very difficult to at times you definitely want to be cautious of your wording, and yeah, you don't want to like highlight something that could bring in a whole lot of negativity. Wow, let's see. I'm trying to read that because I'm trying to process it. Let's see. It's trying to stick. Um,
And Carl, I saw you come back on. I know that I'm sure you've talked to people who've had to think about stigmatizing conditions, and I imagine that some of this has to do with creating a safe space, but do you have thoughts about when people need to talk about difficult things?
Yeah, I mean, I think it's really good to focus on problems with the system and not necessarily problems with the institution. I mean, they can be related, but
Mhm.
like, what are the problems in the system that need to be changed? And the stories that deal with the system are much less, um, there's just much less blame going around. I mean, there's blame for the overall system, but it's more of like, how can we fix this? And I think that's a good attitude to have with these stories. It's like, if you can arc to a solution, or you can arc to something that says that we can fix this, that makes it go down better. Does that make sense?
It does.
Mhm.
And I think there's
Mhm.
actually a unifying concept between the two concepts and the two questions that ultimately I think the storytelling is about the takeaway. And so whether you're talking about a stigmatizing condition or you're talking about a particular institution, the storyteller gets to curate the story. So let's say that you have a birthing person who has substance use disorder and has to talk about the experience they had in the hospital with someone who did a drug screen. They don't need to say what their substance use disorder is. They can say, I felt like I wasn't treated as a whole human being, right? So they can sort of talk about the concept, and that may be a way to get around the stigma. Similarly, you don't have to say, I went to hospital X. You can say, I presented for care, and this is the overall takeaway. But that's
Mhm.
how I kind of put the two threads together.
Mhm.
Does that resonate with you too?
Yes. Can I speak on so when you talk about I'll talk more, as I said, about some of the particulars of treatment when I was walking through this during pregnancy. Because again, everything started during pregnancy, and there are many stories, unfortunately. However, I never bring up a particular place. I just speak about the instance or the circumstances, and how it made me feel, how I came away from it, how I felt unheard, how it helped to lessen my trust. Those kinds of things that could come from any place, right? So I don't necessarily talk about a particular, this I was over at da da da, so I don't do that because that's not comfortable for me. That's not my intention. My intention is to reach the people who are in those same situations or similar situations, and just again give them hope, maybe help them to advocate or navigate through it to find answers that will help them.
That makes a lot of sense. And it also reminds me that you want to be mindful as a storyteller of who your audience is. So if you've experienced something in a particular institution, you should think about telling your story to them, and then you can be real specific because the goal is for them to understand what's happening under their own roof and hopefully fix it. If your audience is more global, like more sort of general, then maybe it's the takeaway and you're not talking about the specific institution, which should get you away from some of those concerns about defamation.
Mhm.
But it's a great question.
Mhm.
Yeah, and I would add too that a lot of stories are multivariable and they have many causes, and I think responsible journalists recognize that it's very, it's it's not always the person who's at the spear, right? The point of the spear who where the problem is caused. It's really the payment system, the whole system that creates that situation. And I think it's worth pointing that out. And if there is a personal problem, yeah, to second Megan's point, is like bring it up with the caregivers, let this person be heard by the people who can actually, he or she can be actually helped by it. That, I think that's a critical thing, that's a different discussion.